Now today is National HIV Testing Day. It's a day created to encourage people to get tested for HIV, know their status, and get connected to care and treatment. Now, according to DHEC, as of December 2020, there were 19,437 residents in South Carolina living with a diagnosis of HIV, including AIDS. Of these, 14,018 were men and 5,419 were women. Now, this morning, I am joined by Tia Robinson, a nurse practitioner and PrEP program manager from DHEC, to talk more about what the virus looks like in our state and the resources that are available. Tia, thank you so much for joining us this morning.
Thank you for having me.
All right, so first things first, I want to have a question. Who all is at risk for HIV?
So everyone is at risk for HIV, but there are certain populations that are disproportionately affected by the burden of HIV, African Americans and youth. And so we want to make sure that we are encouraging everyone to get tested. And this day is encouraging testing. So we know that from an HIV test, if it's HIV negative, we can link those individuals who may have riskier sexual behaviors to PrEP, which is pre-exposure prophylaxis. And this medicine is taken to prevent HIV. And those individuals who are positive for HIV, we can link them to a provider for treatment, because we know with treatment, it's going to help them live a long, healthy life and also reduce transmission. And so if their viral load is low, it's untransmittable. So if it's undetectable, it's untransmittable. So U equals U. So we really want to encourage everyone to get tested, and everyone should get tested at least annually. And depending on your behaviors, you may want to get tested more frequently.
Absolutely. Thank you so much for that information and the fact that this is something that everybody should be aware of.
Yes.
Now, one of the questions I want to ask you about, what are some of the misconceptions when it comes to HIV? I think this is why people maybe stray away from testing or really having the conversation about this.
Yes, so that stigma that only certain people can get HIV because they live this lifestyle. But if everyone is engaging in sex, then you're at risk for HIV. So it's important to protect yourself using condoms, making sure you're getting tested. And so HIV testing and knowing your status will help your sexual health. So it's important to get tested so you know your status. But everyone is at risk. So it's just not a certain person because based on whatever misconception. So everyone should get tested.
That's such good information there as well. Everybody should get tested. Now, I want to talk about where people can get tested. We've said it's important. They might be like, okay, where do I do it? How do I go about this?
Yes, so if you visit our website, scdhec.gov/HIV test, you can order a free at-home test kit, and you can do a HIV test in the privacy of your home. And DHEC will be there to support you if you have questions. There's information to reach someone. But also on the website, there's information on the clinics that are offering free HIV testing today.
Tia, thank you so much for joining us, not only breaking that stigma, but providing some really critical information for our audience. We appreciate you.
Thank you.